As nurses, we're not just medical professionals. We're advocates for our patients, and that means upholding the highest ethical and legal standards in everything we do. This protects our patients, ensuring they receive the safest and most effective care possible. But it also protects us, as nurses, and the healthcare institutions we work in. By understanding the legal and ethical landscape of nursing, we can navigate complex situations with confidence and provide the best possible care for our patients. Let's get started. One of the most fundamental ethical principles in nursing is respecting patient autonomy. But we also have a duty of beneficence, acting in the best interests of our patients. So, what happens when these two principles clash? Imagine a patient refusing life-saving treatment. It's a tough situation. Open communication is key. We need to explain the risks and benefits clearly. As nurses, we have a sacred duty to protect our patients' privacy. This means keeping their medical information confidential and only sharing it with authorized individuals involved in their care. Think of all the sensitive information we encounter: medical histories, diagnoses, medications, personal struggles. This information is entrusted to us, and it's crucial that we treat it with the utmost respect and discretion. But confidentiality goes beyond just keeping quiet. It also means being mindful of how we discuss patient information, even with colleagues. Remember, a casual conversation in the hallway could potentially breach a patient's privacy. Always be aware of your surroundings and choose your words carefully. End-of-life care is one of the most challenging yet rewarding aspects of nursing. We're with patients during some of the most vulnerable moments of their lives, and our role is to provide comfort, support, and compassionate care. This often involves navigating complex ethical and legal issues surrounding palliative care, euthanasia, and advanced directives, such as do not resuscitate (DNR) orders. It's essential to approach these situations with sensitivity and respect for the patient's wishes, while also adhering to legal guidelines and ethical principles. Open communication with the patient, their family, and the healthcare team is crucial to ensure everyone is on the same page and that the patient's end-of-life wishes are honored. In an ideal world, every patient would have access to unlimited healthcare resources. But resources are often limited, and we face tough decisions about fair allocation. Ethical principles of justice and equity guide us. Equal access to care is crucial, regardless of background or ability to pay. In a pandemic, we must prioritize patients for ventilators or ICU beds. By following ethical guidelines, we strive for equitable care. As nurses, we strive to provide the highest standard of care to our patients. But mistakes can happen, and these can have legal consequences. Negligence occurs when a nurse fails to provide the care expected, resulting in harm. Malpractice involves intentional wrongdoing or a breach of duty causing injury. Examples include medication errors, surgical errors, and failure to monitor patients. Understanding these legal implications is crucial for protecting our patients and ourselves. We've already talked about the ethical importance of patient confidentiality, but it's also crucial to understand the legal ramifications. In the United States, the Health Insurance Portability and Accountability Act, or HIPAA, sets strict standards for protecting patient health information. HIPAA violations can result in serious penalties, including fines and even jail time. It's essential to be familiar with HIPAA regulations and to follow proper procedures for handling patient information. This includes obtaining consent before sharing information, using secure methods of communication, and being mindful of who has access to patient data. Before performing any procedure on a patient, we have a legal and ethical obligation to obtain their informed consent. This means ensuring that the patient fully understands the nature of the procedure, the potential risks and benefits, and any alternative treatment options. Informed consent isn't just about getting a signature on a form. It's about engaging in a conversation with the patient, answering their questions, and addressing their concerns. The patient must be of sound mind and capable of making their own decisions. If a patient is unable to give consent, such as in an emergency situation, or if they are mentally incapacitated, there are legal provisions in place to ensure their safety and well-being. As nurses, we have a legal and ethical duty to report certain situations to the appropriate authorities. This is known as mandatory reporting. Mandatory reporting laws vary by state, but generally include cases of suspected child abuse or neglect, elder abuse, and certain infectious diseases. While it's important to respect patient confidentiality, our duty to protect vulnerable populations outweighs this obligation in these specific situations. Reporting these cases can be uncomfortable, but it's essential to remember that we're acting in the best interests of our patients and the community. Remember, ethics and law are the cornerstones of nursing practice. They guide us in making difficult decisions, advocating for our patients, and providing the safest and most compassionate care possible. Keep learning, stay updated on the latest guidelines and regulations of your state, and never hesitate to seek guidance when faced with challenging situations. And as always, thanks for joining Advanced Practice. Stay tuned for more videos on how to be the best, most informed nurses we can be. You can learn more and earn continuing education credits and units at www.advancedpractice.io.